Ian Ramnarine. I'm a cardiothoracic surgeon. My first time attending the CAOH, and I'm really impressed. The level of talks that we've been receiving have all been by experts in their field. You're getting cutting edge information, evidence-based, and real world as well, in terms of, especially with the local system and what the issues are and new data. I really enjoyed coming here today. My talk here was about the update on lung cancer in Trinidad and Tobago. I presented some of the results of our local work, which is to show that the people who are getting lung cancer smokers. We know smokers get lung cancer, but in addition to smokers, we're also getting people who are non-smokers. There's an increasing number of non-smokers and women who have lung cancer now that we are dealing with. What we found is that many of these, the vast majority of these, are already presenting in what they call stage 3 and 4, where it has spread to other organs. The vast majority of patients with lung cancer already have it spread before we know about it. So there are a couple of things that we've been pushing over here. Number one is screening. So if you're a high-risk person, and being a high-risk person will be someone who is a smoker for more than 20 years. Even if you've stopped, you should be checked up by your doctor and get the screening test. Fast-track referrals. If you're having a problem with your lungs and you're breathing, you're coughing up blood, you're having shortness of breath, these things need to be checked by your doctors. If we can find out that it's a cancer early, we aim for cure. We have what we call intention to cure. So surgery forms part of that, where we can actually remove the tumor. But unfortunately, the vast majority of lung cancer patients, as I said before, have spread. So we presented those cases who have had cancers that spread and our treatment is. So treatment in those kind of cases usually revolves around doing a test. Nowadays, the treatment of cancers has evolved tremendously over the last 15 to 20 years. There's something called immune therapy. Immune therapy is treatments where if you test the cancer itself, you can see if the cancer has markers on it and if it would be suitable to treat this cancer with just a pill a day. So we've been advancing our testing, we've been advancing our treatment management. The problem is these pills, we need to ensure first of all whether they would work on our patient. So how we do that, we test the specimen. There's no additional test for you. Sometimes you could do it on a blood test. And if the test comes back positive, there is a very good option, something called immune testing, immune therapy. You can put them on the appropriate medication. And our survival has been fantastic with that. As I said before, with stage 4, when I returned to Trinidad 18 years ago, this median survival was 7 months. Now I've had 10 years and more survivals based on their tumors, their cancers being sensitive to the appropriate treatment. Promising days really, but it's expensive. So the key points really is that smoking has decreased. We're seeing still, the smokers still form a very large part of the people with cancer, but we're seeing more and more women and non-smokers getting cancers now.
That's lung cancer specifically?
Lung cancer specifically I'm talking about. Then the vast majority of our patients with lung cancers have already spread before we even get a chance to see them. They're what they call stage 3 and stage 4. It's already gone outside the lung into the glands or into other organs.
A Sharfus Journal production.